And now, according to the original schedule, we had a coffee break, but with the changes, I think we'll just push on to the last event, which is a fireside chat. And I would like to invite Anat Orgad from the INCD, who will be the moderator, and Avivit Kotler, CISO and DPO of Clalit Health Services. So, welcome.
Hi, everyone, and welcome. First, let me introduce myself. My name is Anat Orgad. I'm the head of cyber guidance and regulation in the INCD for the healthcare sector, and also for critical infrastructure organization. And Avivit is?
Hi, Avivit Kotler. I'm a lawyer, and I am the head of cybersecurity in Clalit Health Services. I work with Professor Ran Balitzer that just left. I will deal with him later. And it's very nice to be here.
Okay. So today's session is we're going to talk about the challenges and huge challenges that arrived ever since October 7th and how it affected the healthcare sector and how it affected our role. So, would you like to start?
Yeah, sure. First of all, I have to say that October 7th was a big shock for everyone, also the cybersecurity area. But I would like to go back a couple of years to 2020, I think. The health sector was not very mature in the cybersecurity area. And I think that with the COVID, and with the telemedicine that was introduced in COVID, attacks began to occur. Okay, criminal organization began to attack hospitals. It was a big no-no, big taboo to attack hospitals, I think, in the past. And with the COVID and telemedicine, they realized there is a profit in that area. So since the beginning of COVID, I think cybersecurity is very much it's more relevant in the cybersecurity area, and everyone is very much aware of the risk. And I think that because of that, we started to deal with cybersecurity as we should in the cybersecurity sector in 2020. And it allowed us to deal with October 7th in a much more mature way. So I think that if it weren't for COVID, we would be in a much more difficult position. But in the last 4 years, we've done a lot in order to build a cybersecurity model that is very much adjusted to the health sector. Like Professor Balitzer said, we have to give medical treatment. So we cannot close the hospital. We cannot tell the doctors not to work with AI. We cannot stop the innovation. So we had to do it hand in hand with the medical staff and do cybersecurity with them. There's also a couple of my team here that are doing it on a daily basis. Okay, they examine medical equipment to see if it's secure. Because the medical staff need them to do the work. So I think that the last 4 years have enabled us to
improve.
Yeah, to improve in an overall manner, but it allowed us to reach October 7th, unfortunately, in a more mature manner. And since October 7th, what we did is we took the practices that we are already practicing into a higher level, because we know our attack surface, so we diminished it. We worked alongside the INCD and the Ministry of Health in order to do more checkups, to do more BAS control, breach simulation attacks, and we have daily feeds and intelligence that are coming from the NCD and the Ministry of Health in order to be more prepared And in fact, there are a lot of attacks on the health sector since October 7th, more than before. Also state-financed attacks, as you can imagine. And we are dealing with it. But I think it's better than it could have been if we weren't prepared in advance. Yeah.
Also, there was a huge attack before on a hospital, and ever since also many things have improved. I think it was also part of it. On a national perspective, yeah, we saw that the attacks increased enormously. We have many more attacks on the healthcare center, and on the sector itself, and we were getting prepared. Everything has changed ever since. From capacity building, we were all forced to move to operational management. We needed to do so many tasks. For example, as soon as the war started, we had to visit all the hospitals to see what happens there, what do they need, how can we defend, how can they protect themselves better. Like you said, we had a lot of intelligence reports that we had to bring them. We worked together with law enforcement and companies, commercial companies, to get more intel, more precise intel that could help and use it to protect all the healthcare organizations. Also, there was a very famous attack on the Ziv Medical Center, which was attributed to state actor. Sorry, I need water. By the Hezbollah. It was very, very important to stop it, and we actually prevented it. It was a CNA attempt of an attack. It was prevented on time, and we were able to prevent much more of the consequences of the attack. And ever since then, we're working very hard to prevent. We do a lot of things, but how do you prepare yourself to protect you have a lot of hospitals with public hospitals. You have a lot of, and also on the Soroka, for example, it was very highly since the war, right?
Yeah, we have Yosef Tal that it's in Eilat. That's our very. I was there yesterday doing a cyber drill with the Ministry of Health. But Soroka is situated the closest to Gaza, so it became the main hospital for October 7th. I think that the major shift since October 7th was the fact that we went to business continuity in a much more elaborate way. So we had a business continuity plan. We did our BIA, the business impact analysis. We knew which hospital needs in order to still work after a cyber attack. Also, the community clinics have done the same, and we did cyber drills along the years. So business continuity was very much on the table, on the management table. But since October 7th, we realized that we need to practice more. Like practice also makes perfect, but not all the time. But we realized that we can identify our asset, we can protect our asset, but eventually we will need to be able to deal with a cyber event. So we shifted a lot of our focus to business continuity. A lot of drills with the hospitals and the clinics. We have 14 hospitals, 1,400 clinics. And the main issue was to work with the administration and the management in order to see what do they need if a cybersecurity event will occur. So the focus was not, thank you. The focus was not on how to deal with the cyber event, because we know that it's it's very well known. We were working with the Ministry of Health, with INCD, with our IR company. We have a cybersecurity insurance. So everything is very well known regarding the technical part and also the recovery part from backups and etc. But the fact is that the hospital were not aware of the fact that they will have to work without an EMR, without medical records for a couple of days or maybe a couple of weeks. So we started working together to do two things. First of all, to get that into their heads. Okay, you will have to work with pen and paper for I don't know, 1, 2, or 3 days, and at first they told us that it's easy. We've done it before. We'll do it again. But when we started to do the drills, they realized that it's not that easy. And some of them, and mainly the new doctors, they don't know how to work with pen and paper. Even the forms was not familiar to them. So we had to deal with that. That's one thing. And another thing that was very successful is to realize what data they have to have in the first hours of the event. So we will be able to do a special backup or upload special information, like critical information, into the cloud maybe, and allow them to work with this critical data in order to continue to do their practice. So we've done a lot in the past 6 months in order to allow them to receive critical data in order to keep giving medical treatment, especially in the hospitals. In the hospitals, it's critical because of the war, but also in the clinics to avoid panic. We all go to the clinics on a daily basis. So the fact is that the medical staff has to have the minimum data in order to give medical treatment, and also there's a special adjustment to medical equipment. On that area, we have to have more focus because of the fact that it can harm lives on an immediate basis. So in order to prevent attacks on medical equipment, we are doing a lot more also in the past 6 months.
Yeah, many drills.
Many drills.
Yeah, definitely. Okay. For us, as the INCD, we are also working on business continuity and helping organizations as well. We're also working on promoting new technologies, such as implementing cybersecurity systems, together with the Ministry of Health, of course, which we guide. We have a lot of systems that they implemented, and they're very helpful against attacks, if it's XDRs, if it's firewalls, if it's DDoS prevention, NDRs to detect and respond, microsegmentation, which is very crucial, especially when we talked about the legacy systems, FA, 2FA, tokens. We also do a lot of continuous monitoring, proactive monitoring. We have the Cyberdome in the INCD, and they're working very hard. They investigate, they do, and everything they investigate, for example, ransomware attacks. They have a lot of collaboration with law enforcement and companies, and we have a lot of collaboration with them, which is very, very helpful. We have tighter communication and collaboration, of course, with the Ministry of Health and the HCO. We work together. We also working on publishing so many, many guidance, conducting training and tabletop exercising, supply chain management, which is very important to look at. Sometimes we even forget that we have the supply chain, which could be our biggest enemy. We perform audits, and we have also the Healthcare Cyber Innovation Center that we're trying to establish these very days, which is very important too, because everyone has innovation, but not many hospitals have cyber implemented in the innovation. Now I want to talk about something that we talked about before with the previous panel.
Yeah, just to add to your last sentence, that's something that has worked very well since October 7th, this triangle between the Ministry of Health and their CERT, the INCD and their CERT, and our SOC team. So this triangle has allowed to deflect a lot of attacks, and also the fact that the feeds are going on those three directions, they allow us to prevent attacks on other hospitals. If we are seeing something in one network, the sharing of the data is very well done. So that's something that I hope will continue also, but
and will improve.
And the state is very well aware of the fact that the health sector is critical in this time of war. So I think we've seen that there was a lot done in the state to allow us to work better and in a more secure manner this past 6 months, but also before that.
Okay, I'll just explain that we have in the INCD we have the 119 call center where everyone is calling and we collaborate with if it's a CERT to CERT and SOCs, and we work together with the Ministry of Health SOC, and we share information. For example, if we have an attack and we have IOCs, we send the guidelines and recommendation to the nation and especially to the sectors. But in my role, of course, it goes to the health sector, but we share the information for everyone to be prepared and defend against it. Can we move to the AI?
Yeah.
AI, very challenging. Okay, so AI is here. Artificial intelligence, everyone is using it. I have it as a personal assistant. I feel that like I have my own personal assistant. I use it for everything. Everyone is adopting it for personal, professional use, and it's just the beginning. It's just the start of it. In the health aspects, it's fast, it's accurate. It has algorithms that can help us get better medical details, data, better diagnostic assistance. We talked about it before in the previous panel. We're all adopting it. It's inevitable to use it, but with all this good, it also brings a lot of bad things. Many risks.
Yeah.
We're starting to hear about attacks that are promoted and done by AI tools. How do you deal with that?
Yeah, well, it's a very big world. I think it's also it's still a buzzword. Okay, we're saying AI regarding every algorithm that is innovative or everyone that talks about ChatGPT is saying AI like ChatGPT is the AI of our world. I think it's not very clear to everyone what is AI and what can we do with it. And also, if we're talking about regulation, it's not, we don't have any. Okay, so let's start with that. We have a lot of things that starts to pop up in the US, in Europe, in Israel. There is no regulation regarding AI in the health sector.
Yet.
And yet. But everyone is very fascinated, and we are starting to adopt AI solutions. And if I'm attaching it to a cybersecurity protocol, the best thing in AI within Clalit is the fact that we are doing shift left with AI. Okay, so the cybersecurity team is with everyone that wants to adopt AI from the very beginning. If it's in the cyber, if it's in the medical devices, if it's in big data, if it's in innovation, Professor Balisel talked about it. We are going together from the beginning until the end in order to make sure that when when someone uses AI, they do it in a secure manner. So we have a lot of examples, but first of all, I would like to separate AI from OpenAI. So AI that is done on-prem with our own developers. Professor Balitzer has a lot of developers that are very talented in promoting algorithms to do preventive medicine. So this is one thing that we can promote as tools to help doctors, and it's more secure because it's on-prem. And when we're talking about OpenAI, we have this challenge that we need to work with OpenAI, but to do it in a secure manner, we have to invent something that will give us the solution. So I can say that in Clalit, we are working with Microsoft Azure in order to build like a playground in Clalit cloud. In order to start research and play with AI, because I don't think that we will be able to use AI instead of doctors for a very long time. So we will be using AI for researchers and with data that is not classified. But in order to work with AI that can replace decision making with the doctors, I think it's a little bit far. So at this time, we are focused on the playground, allowing developers and researchers to access OpenAI in a secure manner with de-identified data. And afterwards, we will be able to check those algorithms, to check the solutions that the AI is presenting us. And there's also the ethics, the medical ethics in this area that will need to be checked on Professor Balitzer's side. So we will work together. We will check the security part of things. Professor Balitzer will check the clinical part of things, and hopefully we'll get to do better medicine with it. Also, just to add another thing, this is on the medical area, but we are aware of the fact that we can use AI in cybersecurity. So this is also something that we are now researching, also with vendors that we are working with that are introducing AI in the cloud in order to do better analytics and give the SOC better solutions. And this is something also that we'll be working with in playing with at first and see if it can allow us to do security better, because we know that we'll have to use AI to prevent attacks, because hackers will use it to attack. So it's a big challenge, and
also there is also the cloud security as well.
Yeah, that's another panel. That's another panel.
Yes. Okay. Regarding the INCD, of course, we were talking about that it's evolving very fast, but still it's too fast. We still don't have, like she said, they're starting to build up regulations in other countries, but in Israel we still did not have an outline. We didn't outline a policy or a methodology or like a specific best practice. But we are working on it. Eventually it will come. And also we have a new head of center, Eliav, who will be taking a very, very important role as a methodologist in the INCD. And hopefully we will have it soon, no? Eventually.
Next week.
Right after this session.
Yeah.
So that's about it. Anything else you would like to add? You would like to say? Any questions, anyone?
Have questions?
That's a major risk. By the way, tomorrow there is a great panel about supply chain by Shani. She will present the supply chain on perspective from the INCD. That's an issue we're working on. In the INCD, I think we do a checkup, a very good checkup on our employees. But internal.
Yeah.
Well, you have tools to prevent it, but
Yesterday, I think there was also a publication about 3 employees of insurance companies that sold data, I think for a couple of years now, and they were indicted. The human area, I think it's beginning to be even more of an issue in the past years, also in the regulation area. But and also we can see that the checkups that we are doing on employees are beginning to be more profound, because we know that whoever we employ will have access to major data, and we'll need to check on him. But we're checking only in the beginning. So afterwards, we are dealing with the fact that we need to do a lot of awareness training, and we have to do a lot of controls on the data that our employees are accessing. So like Professor Balistel said, we have great medical staff and we have great analysts and developers, but we have to do those layers of control and security are not only for the attackers. So if we are looking on it on both ways of the map, so there's an attacker and he has to go through a lot of security layers in order to access the data. And we do it with employees the same way. Okay, so they have the identification part, they have the authorization part. We are recording certain areas that are more sensitive, a lot of controls that are done to see that the personnel are not doing something that they shouldn't have. So we have a lot of controls. We are dealing with cybersecurity events or privacy events with employees in a very, I think, very strict manner. So I think that there's an awareness of the fact that we are monitoring the employees, and it helps. But basically, we need to say that in the end, it's a felony, and someone that wants to commit a felony, I think you will be able to do it in one way or another. I don't know, take a picture of the screen or something like that.
There are ways to bypass.
There's a risk. There's a risk.
We do have collaborations with certain countries, not regarding the AI. I'm not. It's not my specialty in the INCD, but it will have eventually. So you will have to address it, and I know that we're working on it. Many governments. Entities are. It has to be, but I think they're still learning it. It's so rapidly, it's so fast, and it's evolving so fast. Like that, you need to really understand it. I don't think we all understand it enough. The impact of the AI, of the open AI. It's amazing, and even the attackers are still learning it, and they're evolving it. It's here.
But the startups are starting to make money out of AI.
Yeah.
So there are startups that are dealing with two things: cybersecurity and the AI, and also the startup that are saying that they can approve if something was written by AI or not. So that's something that goes on very. They have good business. Those startups, but. I think that's the major issue, because it's very rapidly evolving, and I think it will take time until we will see the AI regulated. I don't see it coming in the couple of years from now. I think it will take time. Yeah, I understand the question. First of all, what you said, you need to say it to my management and the board, because that is saying that I need 200 more employees. So basically, we have to be very, very big in order to deal with every change in our assets. So it's a very good question. And the cybersecurity area in the health sector is not like the banks they have more money, so more funds, more employees. That's an issue. The fact that we don't have as many employees as in other sectors like the financial sector, for example. But we deal with what we have. So basically, the health sector doesn't have a lot of funds also for innovation and buying medical devices every Tuesday. It's not something that is done in the health sector because it's a public sector. We are a non-profit organization, so we have a work plan. We know not 100%, but we know 80% of the year budget, and to which assets it will go. So we work together to see that cybersecurity architects and our DRC team are going with those projects and guiding everything that is security related. To new things, it's easier. The legacy part is the much more difficult part because we cannot change every medical device that is working on Windows 7 or I'm not saying XP on purpose, but we cannot change everything because it costs a lot of money. So we are doing compensating controls in the meantime. So there's the legacy that I hope will die as soon as we will be able to put it out, and we are putting the main efforts on the new medical equipment, the new projects, the new assets, in order to do their security by design and deal with compensating control on everything that is legacy.
What she's trying to say is, as a CISO, she confiscates with a lot of creativity and professionalism, and she's doing a great job. Thank you everyone for joining us. Thank you so much, Avivit, for being here with us, and have a great evening, everyone.